Okay, I'm here with Daniela, also known as Daniela Beauty Nurse, my friend who is a beautiful nurse. And typically, your line of work is pretty different from what you're doing right now. So, why don't you give a little bit of background, Daniela, about what you normally do and now how you've kind of shifted lately because of the pandemic?
I've been working as a nurse for around 21 years. I've always worked at Toronto General in the cardiac ICU. I started off on the cardiac floor years ago, obviously 20 years ago. And then I moved over to the cardiac ICU. I continued to work there part-time as I was building my cosmetic injection business. So that was probably about 5 years ago, I would say, that I became an injection specialist. And at that point, I continued to stay part-time at the hospital while I built my business. And then I went casual and always continued to keep my position at the hospital because I always felt that it was important to keep my skills and being able
Yeah.
to go to the hospital once a month and just being able to be at the bedside because I do love it. It's just not something I wanted to do for the rest of my life. I wanted more time leverage.
Telling me that how that's been important to you, that you keep your skills sharp and stay engaged with the hospital. And now it's obviously at a time like this super vital that you've done that.
I am so grateful, honestly, Heather, because at this point, all I keep doing is thinking to myself, I love doing my injections. It's truly my art. And putting that on hold right now for the safety of my patients and everyone has made me realize that I need to step up as a nurse. And I committed myself to doing more shifts at the hospital. So last week I worked my first shift at the hospital. And I was scared to go, I'll be honest with you. I've been waiting to take shifts because I've been asking every time they call me for a shift, I've been asking, like even weeks ago, what are you guys doing for protection? Is there anyone downstairs, anyone at the front? And to be honest with you, it just started, I want to say probably 2 weeks ago. So when I did my shift, when you walk through the front doors of the hospital at Toronto General, they do have people that are sitting there security and two individuals that are covered in a little box, and they actually get to ask you questions about have you traveled. They're checking temperatures, and we're also on lockdown with no visitors. There's no surgeries, elective surgeries going on, so only emergency surgeries and families that patients are dying or end of life are able to come and visit. So I felt really, really safe knowing that.
Yeah, you told me that you were kind of, especially because of the media and looking at what's going on around the world, you're a little apprehensive about going into a scene that could be chaotic, and it's not at all at the moment. In Canada, we're experiencing something different. You told me that it was really calm and it felt um, comforting. You do feel like it's
Yeah,
not
I
chaotic.
felt safe, and I'm glad that I did the shift. Again, that was the calm before the storm. I still haven't really seen any. I continue to ask when they call me or when I'm at work how things are going. I continue to
Yeah.
stay talking with staff and stuff, and they all say that so far we haven't had any cases. They are taking things seriously. So as soon as someone comes in through a merge, if they suspect or there's any of those questions that they've had a temperature or any type of flu-like symptoms or anything, they automatically get put into isolation. Now the issue is equipment. So
Yeah.
before this all came through and it started in China, what had happened was we had a lot of equipment that was stolen from the hospital, and it's not just our hospital, it happened globally to all the hospitals. So we are short on equipment because of people stealing equipment, masks, gowns, everything you can think of was taken
So
from us.
do you mean a consistent kind of gradual thing, or like
That
all of a sudden things were stolen?
things were gradually taken, and it had to be someone. We don't have cameras and stuff, which I wish they did have cameras put around the hospital. A lot of equipment was taken, and this has caused chaos because what's happening globally is that we don't have enough equipment. So nurses are going in to do their shifts, and they're being told that unless it's like really serious or something, then you can wear an N95 mask. Otherwise, there's been this constant struggle with our union fighting over, the fact that basically they think that it's droplet, which it is an understanding that it's droplet, but it can also be airborne. So that has been
Yeah.
the big argument, is us having proper equipment.
You need your eyes protected. You need
Yeah,
everything. I'm
yeah,
seeing pictures of people wearing surgical masks, which when I see a photograph of nurses and doctors wearing surgical masks, I'm a little nervous because like I know, like you know, that this is not just a matter of
no,
contact. It's far more serious. Yeah.
yeah.
Are you aware that our government gave away 16 or 17 tons of PPE equipment a month ago to
No,
China? Yeah,
no.
it did. Um, so this has kind of come to light, and I'm sure we're going to talk about it a lot more in the coming days. But it's super frustrating to know that we are short on supplies when after the World Health Organization gave recommendations for countries to be on alert, our government gave away a ton of PPE. And so when I'm hearing that our hospitals don't have it, I'm just appalled.
Well, this
Um,
the thing is, I mean, I want to go. I mean, this is the way I explain it to people. People ask me all the time, how are you going back into the hospital? How are you not feeling scared? You have a family to come home to.
yeah.
And honestly, this is what I explain to people out there and how they have to understand, regardless of what's happening in the world and, not, us not having proper equipment and stuff. I consider myself a soldier. Just like any soldier on duty needs to go and fight for their country, people need to understand, being a nurse, that is our obligation. That is my number one priority, to be able to go in there and, be selfless and just be able to go in there and help and just have the most best practice that you can in keeping yourself
Mm.
safe and clean. So last week when I went in, I'll be honest with you, I was really, really careful. I continued to clean. Thank God the hospital's full of cleaning equipment. So I
Yeah.
continued to grab wipes. I want to say probably every 15 to 20 minutes I was cleaning my area, because there's so many people that come in, doctors touching, different equipment,
Yeah.
different stuff. So I was constantly wiping down my chairs that I was sitting at, my computer, continuously washing my hands, going to a sink and washing your hands, using alcohol, wipes, everything to continue. The other thing that I did was that when I went into the hospital, I used to always go in with my scrubs because, I'll be honest with you, nurses are lazy and we wake up so early for our shifts.
Yeah.
I didn't
Yeah.
do time. I made sure I brought a separate pair of shoes.
People walk around in their scrubs typically in the close neighborhood around a
Of
hospital or in
course.
the
Yeah.
car and out of the car. Yeah.
Uh-huh. So this time what I did was I made sure I changed at the hospital. I brought separate shoes, left my one pair of shoes in the back, and then I changed into my outfit. And then the outfit that I switched into, once I left the hospital, I put it into a bag and I kind of washed things separately on their own, just to help out.
That kind of answers my next question. I was going to say, what are you doing to protect your family? This is something that's coming up a ton. I'm hearing a lot of discussion about it, and I've even seen recently videos that some nurses in the States have posted, clearly upset, scared, nervous, and they're saying, I can't guarantee that I'm not bringing this home to my family. And so I feel like I need to opt out and say, no, I'm not going on that unit. I'm not dealing with those patients. And there's some controversy about that, right? Because as you said a minute ago, if you consider your position to be like a soldier, then you don't opt out of the dangerous stuff. But there's a line, isn't there? Like we throw ourselves into reckless, unsafe situations. So how are you protecting your family? What steps are you taking when you come home from the hospital? And then maybe you could elaborate more on what you think about that, like safety issues for nurses.
So when I come home from the hospital, like I said, first thing I do is leave my shoes that I walk through the hospital with, or even outdoors, which you should be doing regularly. If you're leaving your house, if you're going for walks, people don't understand your shoes carry bacteria. So the first thing
Absolutely.
I do is I walk through my garage and I leave my shoes there. I leave them there, and then afterwards, later on or the next day, what I'll do is I'll go put gloves on and I'll disinfect them with water and pure bleach. You cannot go wrong with bleach, honestly. One part bleach. So I've just been disinfecting that. Then what I do is I come in, like I said, and first things I do is put my scrubs away, make sure I wash them so they're away from family. And then I go and take a shower and just really scrub down as much as I can before anybody comes close to me. So those are some of the things that I do when I'm coming from the hospital. But I truly am blessed for learning so much about infectious disease, being in the hospital for so long. Toronto General is like really, really particular about it. And we have people that come around and audit us. So I'm really taking in all of that infection disease, prevention practice into my everyday life. So I'm trying to basically educate people about thinking about, surfaces and things that you're touching every day from morning to night, even being home in self-isolation. If you're leaving your house, if you're going to grocery shopping, when you go grocery shopping, what are you putting on? Are you wearing gloves? Okay, so are you wearing the gloves and then going to touch your wallet? Like just being aware of the pattern of what you're touching and surfaces and how you're preventing when you come home.
Once you start thinking about it, it's mind-blowing. I have been thinking about that as well, and I'm taking my cards out of my wallet and I'm pulling the zipper, and every bit of that point of contact that I go back and try to clean it, very difficult. But you also had some great training during the SARS outbreak.
Yes, so this is why I guess I could say that I'm a little bit more calm. A lot of people think family-wise, when I speak to them, they think, oh, you're in denial, you don't know what's going on. I really want to make a point to help everybody understand that this is real. This is a panic. This is a pandemic. I'm not saying to be relaxed and, etc. But one thing people need to remember is that Canada was one of those countries that were on our own dealing with SARS. I don't think people remember. If they could go back and just put themselves in that position and remember what us nurses were dealing with, because I lived through it at Toronto General. Like I said, we had 2 floors that were shut down. I was a new nurse being sent all over the hospital because I was casual at the time. So I needed to go and cover shifts for nurses that were working in the SARS unit. And I'll be honest with you, they were probably more careful back then than they were now. The only difference is we had the equipment because it was only Toronto that was dealing with it. It was China and Toronto that were dealing with that, and it wasn't a global thing. So I do feel safer knowing that living in Canada, I'm proud to know that we have been prepared for something like this, and that we are taking proper precautions. Like I said, if it got really, really, really bad, I just don't know at this point, equipment-wise, how we would be. And that makes me nervous.
I'm hearing that people are reusing masks, reusing gowns, certainly in New York where they are completely overwhelmed. And that is really, like, to be clear, that's different than what we have in Toronto right now. It's not like that here. But even without that huge influx of patients, are you guys low on supplies? Are you reusing stuff? Are you rationing it?
Right now, no. So I don't work on the floor, but I've talked to some of my nurses that I used to work with on the cardiology floor. And what I'm being told by some of these nurses is that they get two surgical masks per shift. That's it.
Okay.
And they need to use them according to. So there's a lot of anger, I think, with a lot of the nurses that are working on the floors. Like, I'm in a cardiac ICU, so I feel like we're prepared. I know they're opening up a separate unit in the PACU that's prepared. I know the ICUs, we have 3 of them at Toronto General, and all 3 have been have beds that are ready to go if it became worse. Like I said, the nurses on the floor are really feeling used and abused, and I think they're more scared there. Because at the end of the day, I mean, how can I explain it? I'll run you through a day even in the cardiac ICU that makes me nervous. So working in the cardiac ICU, if you have the arrest bed, so we're the code blue team. If we've got the code blue team and we're taking the arrest bed from ICU because they need help, the medical surgical ICU, what happens is it's urgent. So someone's arresting down in the emerge, we get a call, we need to take this arrest patient, and sometimes the proper precautions are not taken in those situations. So I think that's what's making people nervous, is that us nurses, it's our natural nature to just jump in and not think about what's going on with that patient. And if that does have coronavirus, then we just spread it amongst all of us. So I think we're really trying to focus on how can we have safe practices when it comes to emergencies. So there's a lot of mock code blues going on at Toronto General. When I was there last Thursday, there was a lot of code blue, like I said, mock code blues, meaning that the doctors, the nurses, everybody are getting involved and trying to simulate basically what would happen if they had an arrest.
That's good. So you can work on getting really quick with
Yeah,
precautions, because time is everything. Like you said, you just want to jump in, but if you practice every day, then you should be able to streamline and get really quick at
yeah,
being safe. Well, yeah.
yeah. But it has been a big adjustment. I'm missing all of my clients, and the other thing that was difficult is we were just in the middle of launching our cosmetic course. So we had to put that on hold. We actually had some students that were registered for April, and we've now basically postponed it to May, and we'll see how things go from there. So it's been a big adjustment. I mean, being home and supporting the family and stuff. Like I said, I'm grateful that I have the hospital to fall back on, because other nurses that maybe didn't keep their positions at the hospital, or don't know what to do, I'm just not quite sure how all these small businesses are going to survive. I know that there's help from the government, which is great, but it's still not the same amount that we were used to that was covering our households.
Yeah, it's the cosmetic medical industry, this huge area, which happens to be where you and I both spend most of our time, has just been like a switch turned off, and it's
Yeah.
very strange and it's very surreal. I have heard that there are other cosmetic surgeons and plastic surgeons now drafted to fight the pandemic, right? Just like you've come out of that and kind
Yeah.
of jumped. Do you know anyone else like yourself who normally spends time doing a very different kind of medicine and
I
is
know there's a
drafted?
lot of the doctors that I've seen. I'm trying to think. There's one, Dr. Mike Roski, which I follow. I love his work, actually. He's really good. He's been doing a lot of um, live teachings and showing live consults and stuff. I know a lot of the companies are doing online teaching, meaning they're trying to do live calls like this, where they're doing some interactive teaching. So I think it's been people trying to adjust from being in their homes to now switching everything over to social media. And again,
Yeah.
God for social media, because if we didn't have technology and social media, we wouldn't be able to do what we're doing right now. So I've been doing even some answering a lot of live consults with clients over the phone, over Instagram, over the website. So thank God for that. I mean, for having social media and having technology to be able to do that. But yeah, a lot of people are basically coming forward and they're trying to help. I mean, I know I got an email from the Canadian Nurses Association, which is usually for the public. And I was actually really, really shocked, because it was an email basically saying that if nurses were non-practicing for the past 3 years, that they could come out of non-practicing. So I think they're
Right.
preparing themselves for like the worst at this point.
Yeah. That's the impression that I've gotten as well. I've been getting a lot of emails from our nursing association, the RPNAO, now it's called
Yeah,
BDRPN, and those updates as well, that they're changing some of the guidelines and expanding them to remuster nurses that have essentially retired to come out of retirement. Um, and I have a hard time gauging, because I'm not working in a hospital right now. I have a hard time gauging whether that is overkill or, I
I
mean, they're talking thousands of nurses are now on a call list ready to go, like soldiers on the front line. But I'm also hearing that we don't have that many COVID-19 patients, and at the
no.
moment we are maybe more prepared than we need to be. Or
Yeah, that's exactly what I feel. If you look at the numbers, honestly, every day you'll see updates, and honestly, Canada's really not that bad.
yeah,
Like I said, I think us Canadians are really good with listening. We come together as a community. We do everything. We listen to what we need to do, and I feel like a lot of these other countries that it exploded, I mean, they just weren't listening, and it's a lot of, unfortunately, the young generation that, it's hard for them to be locked up, so they think it's okay to go out, and they're the
yeah,
ones who are picking it up. And as much as people are scared to bring it home to their families, it's not us that are at risk. I mean, even if we get it, I mean, unless you've got health issues, people really need to stop and think to themselves, it's about who you can infect. So for
yeah.
me, I away from my parents, and they're adorable because they actually just popped by today, and what they'll do is they'll drop off food but come with masks and gloves and everything. They make sure they're 6 feet away from us. They drop the food off. we haven't been able to like touch or hug. We haven't been hanging out. Like I know a lot of other families that are getting together and still saying, oh, we're safe and let's get together. But no, it shouldn't be it should be complete social distancing. So that's what our family's been doing, which has been really difficult, but you gotta do what you gotta do to keep your family and your parents that are elderly more safe.
Yeah, I have the impression in general that our society in the greater Toronto area, as far as I know, have been taking this seriously for a while. My son and I have been unofficially self-isolating since the beginning of March. When I first heard about this overseas because of the problem, we started being more careful, cleaning everything that comes in the house, not having guests over, not socializing. We had that top of mind quite a while ago, and I think a lot of people did. So maybe we're seeing the results of that caution.
Yeah, I think that people just need to be cautious, but like remember that you're home. This has been a big adjustment to all of our routines and everything, but at the same time, don't overly, all I can recommend is don't overly watch the news. The news has been a really, really big, I think it panics everyone, and it's great to panic and to scare people because I think a lot of people do need that because that's what's worked and kept us inside. But at the same time, we need to stay positive and come together as a community, and understand that it's okay to go in your backyard or outside or go for walks as long as you're staying away from people. I don't have a problem with that. Being a nurse, I'm trying to go through the whole protocol, and I don't understand why, if you could step foot in a grocery store or the LCBO to go get things, I don't see why we can't be out having some fresh air, just making sure that, we're staying away from people walking on the other side if there's someone coming close, just being aware, keeping your shoes in the garage, like I said, making sure you're cleaning stuff. If you're coming home with groceries, make sure that you're, maybe leaving them outside, put them on the floor, don't put them on your countertops, being aware of all your surroundings. But just
I went for a walk a couple days ago and people beelined away from me on the sidewalk. It was so funny. And I also experienced people giving me kind of like evil eyes in the grocery store because I didn't mask. But when we have such a shortage of masks and people that to work with in makeup effects, like special effects teams are now giving their gloves and their masks to donate, right? And if we're donating these supplies to hospitals, then why am I going to walk around with a mask on? I stay away from people. I keep a distance and I don't touch everything.
Well, that's why I think people feel secure, and the thing is they get more power when they're wearing these masks and gloves. But I even watch, honestly, so yesterday as I went out, I had to get some groceries. And number one, I was in Longo's and like nobody was wearing masks or gloves. Nobody was really staying away from everybody. Then I watched, okay, so the counter is kind of like they've put up this plastic thing where it's like you're covered from, the cashier. But then the cashiers are wearing the same gloves the whole day. And I'm like, they're touching your money and this and that. And I'm just like, money. Money, like I'm aware of this, and I'm just like, what is going on? Then I went to the dollar store to get stuff. It was the same thing. It was like, the same gloves and, touching my stuff, and I just didn't want her to touch my money and my cash. And then I'm like trying to put my cash in my wallet. I'm like, yeah, like I'm thinking of germs. I think it's just like, you're just thinking.
Yeah, I was explaining that to my son. Gloves aren't magic. So putting a pair of gloves on and then touching everything is the exact same transmission of using your bare hands, unless you change the gloves every single time. So if you take them off and you don a fresh set of gloves, okay, but nobody's doing that. They're wearing them and touching.
That's what I'm saying. People are not aware. I do have a friend, actually, you were speaking about donating stuff. A lot of people, honestly, I have to say, through social media, I've been so blown away, and it's so nice to see humanity come together as a community, and see, number one, so many people that have food companies and food prep companies or restaurants have been donating to hospitals food for all the nurses. All the love for the nurses has really meant so much to me, because you know what, we do feel used and abused in the system. And anytime there was ever cuts or shortages or anything like that, it was like, throw it on the nurse, throw it on the nurse, throw it on the nurse. So it's nice to see everyone come out and to truly be blessed for the healthcare, you know, and what we do and appreciating it. And then the other thing is I have friends that are in dental assistants. And I do have a friend yesterday that I noticed was giving away boxes of masks and stuff that she found and she donated. So people are coming together, and I think being, you know, more selfless and trying to give away and trying to help the community however they are. So it's nice to see that, you know.
I've seen the donations as well and the calls going out on social media. It's beautiful. I get the sense that the community, people in general, are loving nurses and doctors right now. And there's a lot of love there, but some of the frustration on healthcare staff's part is probably the sense that their own organizations and hospitals and government are not protecting them. Like, you know, people are sending their hearts out to you, but your own organizations that are supposed to protect you, not as much.
Well, the other thing I wanted to bring up, actually, I want to say about a week and a half ago or 2 weeks ago, our union had a conference call with us, and it was interesting. It was really nice, actually. They called, and it was a huge conference call with thousands of nurses online, and they're basically fighting every day for nurses at Queen's Park. Because what they were saying was, in the beginning until last week, Thursday, a lot of people didn't know this, but nurses that were coming back from vacation were told that they need to come back to work if they're feeling fine, even if they've traveled. If they're feeling fine and they have no fever, they're to come to work. So I have friends at work in the ICU that traveled 2 weeks ago. Okay, one came from Korea in particular, and called into the hospital and said, oh, I wanted to know, should I be coming in or should I be going to self-quarantine? And the hospital's response was, no, come in. They were making nurses come in. Okay, first of all, you don't show any symptoms for 14 days. So how does this even make sense? So this was a big argument, but that finally got changed because last Thursday, we had a nurse that was working that had come back from vacation and never said anything. Then finally, I guess, brought it up to the nurse manager and was sent home that day. So I picked up her assignment. So they are doing that, but I think it's absolutely crazy.
As of a week ago?
Only a week ago.
This is crazy to me because the concept of infection control is not new. Like, this didn't just come on our radar. As a nurse, and even as one who's not in the hospital setting anymore, I know how this works and how to be cautious and careful. And nurses like that one, you know, saying, I think I should stay home, they're using their knowledge and their best practices to try to do their best and be safe. And then they've got organizations contradicting what they know is safe and best practices. That's really frustrating.
Yeah, actually really crazy to think that, you know, you got to question that. But I think what's happening is that now that this is official and nurses or people that have traveled are staying home, this is where the nurses come in. So it wasn't about being prepared for having maybe the patients that are going to be coming in. It's actually, we need coverage now for nurses that may not be available, that need to go into self-quarantine. So if one nurse, so let's say we have 4 or 5 nurses in our unit, that's 4 or 5 nurses that are off for 14 days. You need to have people there to work. So I think there was a huge concern about, are we going to have enough nurses on the front lines? Like, are people going to be coming into the hospital and having a nurse? So I think this is where they're thinking ahead. It's not even, you know, how many patients are we going to get? I think they're thinking also of not having enough staff.
That makes sense, yeah, because under pressure in a situation like this, people will start to call in sick, or they may actually be sick, and then you have
or there may be people that have to be off. If the people are immunocompromised or have family at home, this was the other thing that came up too, is families that are looking after someone that's immunocompromised, that are nurses. They've been really scared about this, and I think the union's been fighting for something like this for them to be off during that time. Pregnant friends that are pregnant nurses. My God, it's like, I know during SARS they were allowed to stay home, so I don't know what they're going to do with.
Well, they're saying, because this has been discussed a lot, the pregnancy question, and what I'm hearing is medical experts saying we have no reason to believe at this time that there's any extra or unusual risk to the fetus. It's not a problem. But they also said they didn't think this could be transmitted from people to people.
I know.
So You know, it's fluid, and this information that is correct one day is sometimes, you know,
I think it's
changed the next
day to
day.
day because we were not expecting this. Like, it's actually really interesting because before this all came out, there was actually a show on Netflix called Pandemic, and I found that very interesting. And still to this day, I I'm trying to understand it, and it just sounds really weird to me. But I won't even get into that kind of political thing because that could take another whole conversation on
Oh
it.
yeah,
But it's
yeah.
interesting to see how many people are involved when there's a pandemic and trying to control things that are going on. But I don't think anybody was prepared for anything like this. You know, all we can do at this point is just
Hoping,
stay positive and know that
yeah.
one day we'll be able to look back and this will just be something that's in history and we can put it all behind us.
And we will learn from it. I'm hoping that our experience with SARS has given us an edge of some sort, right? Because
I really
Toronto
believe
really
it has.
a lot.
I really believe it has. Did you work through SARS? Were you in the hospital at that point?
No, that was
No.
just before I got my nursing license. So I was behind, yeah. I remember, and I actually have a book. Oh, what is it called? I'll find it and drop a link later. There was a book written by an ER doctor who experienced that
Yeah.
and wrote a novel about it. And just there was a lot of chaos, and there was a lot of politics and a lot of
Oh,
fear.
so much. That's why we dealt
Yeah,
with, like, politically. We had travel. We had Canada's tourism was like down to nothing. Like
yeah,
it hit us a bit hard. So I think
yeah.
say we've been through something like this. At least we're blessed. I mean, this is a little bit more intense and definitely more.
Well, we
Um,
never shut down communities either, though. Like this whole quarantine, having businesses shut down the way they are is just unprecedented. So hopefully, the suffering and the huge financial loss that this represents is worth it. Hopefully, it's
yeah,
worth it.
yeah.
Yeah. Well, I have reason to be optimistic based on what you're telling me, because it doesn't sound like we are overwhelmed with patients yet. Overwhelmed, but not with patients
It,
yet.
you know what it is right now is the uncertainty. Uncertainty.
Yeah,
So knowing when is this going to be over? Like a lot of us that have our businesses are like, okay, so business is on hold. They said 2 weeks, but then what? Like there's
yeah,
still like, do I book clients? Am I allowed to open up? Like, I'm getting a new place and I'll be renting a, like, I actually am like, I'm getting a new place. Thank God things have been put on hold the way they are. But
yeah,
all I keep thinking of is people that have their own spas and their own medical spas that had to shut down, that are
yeah,
paying dollars in rent. Like even that money from the government is not going to cover the overhead that they've lost. And
yeah.
like how long is this going to happen? Like no one's really talking about that. You know,
I am really concerned about that. I'm concerned for my clients because my clients are cosmetic surgeons and aesthetic nurses and doctors, and
yeah,
their income depends on a steady flow of clients, and
that,
to be shut down for this long is a huge problem. Yeah, so
yeah,
my heart really is going out to my clients and a whole industry that I'm passionate about and that I love to write about. And at the moment, I've got not much to say because we are all on hold, you know.
yeah,
I do think that marketing during this time is important, but it looks different, you know.
yeah,
I was talking with some friends the other day about marketing at a time like this, and I feel that honesty and having really raw conversations, no BS, no fluffy
no,
stuff, but really talking about what people are concerned about, addressing their concerns, being honest, that is what is going to connect with clients and that customer base, right?
yeah.
And keep the connection while everything's on hold. Yeah, what are you doing for your
So
business connected
So
with
for
your
my
clients?
business, basically what I've been doing is, like I said, thank God for technology and social media. I've been keeping in contact. I'm really just trying to find new ways to build and just think and rebuild the business. So I'm staying connected. I'd highly suggest to a lot of people to continue if they have social media and Instagram account. Honestly, it's really important. I built my business so quickly with using social media, just for advertising and everything. So just try to stay engaged with your clientele. Every 3 days, post something. I've started doing live videos. I've started teaching people about my lifestyle, about what I'm doing with my routine, about how fitness is my, other thing that is very important to me. So just teaching people how to be healthy from the inside out during this time. And as hard as it is to all of our routines and, try to get used to this, you just got to make the best of it.
I saw
Right.
your video of filming your fitness routine in your basement. You switched from the gym to the basement.
That was
yeah.
interesting and tough. And I'll tell you, every day it's tough, but every day it's like I'm sitting there and I'm like, oh, let me try this. And you don't even need that much equipment. I literally did not buy anything. I knew a lot of people that are going crazy buying equipment. I have a simple bench. I have weights that are 10 pounds. I have resistant bands. And I'm just doing what I can with that, and online, of course. I do F45. So of course they have online workouts. So it's fun. I've been working out with my little daughter, with my 11-year-old. She'll come downstairs and she's like, let's work out together. So it's nice to have like companionship,
This is something really unique and beautiful about this time. In the midst of so much fear and tragedy and worry, there's these delightful little silver linings that I've noticed, which is people opening up a bit more of themselves, and you're getting these really honest glimpses into people's lives. We're getting creative. Like you know that you don't need a lot of expensive equipment, and to make a video, you don't need an elaborate studio. You don't need all this accoutrement.
You just need a simple, And thank God for, like I said, the internet. It's really not difficult. There's no excuses. Go on and find a YouTube workout video. I mean, you can do it anywhere. There's tons of videos online that you can find with even no equipment if you had no weights or anything. I've been seeing people using jugs of water. I've been seeing people using a bag of peas, or people are just, I feel like everybody's just becoming more creative. I find that people are cooking together. No one was cooking before, and it's like now it's like in the kitchen and they're baking and they're cooking, and
so you have time on your hands. May as well make some bread, or cook something that takes a few hours because you have time. It's nice.
Listen, like I said, it's been really difficult because I'm a go kind of person, and I find that it's been really difficult for my mind. I'm used to being busy. I'm a go-getter. I have goals. So for me, it's like I worked for so many things and everything's just been put on hold. So it's been really difficult trying to get out of there and trying to, of course you go through different stages of grief because this is a loss, right? To all of us. So you go through, the anger phase, and you go through denial, and it's the same thing. And I think I'm at that point where I'm at acceptance now. And I'm really just trying to hold on to any memories that I have, or building, what can I do in this situation? How can I make, this the best situation that I can, and just accept it is what it is.
Right. Yeah,
There's no
I settled some acceptance. Like, I was upset at first when my business changed dramatically and worried, like a lot of people. And now I am shifting into like looking for opportunities, thinking differently, reaching out and communicating a lot more with people. It's a kind of acceptance.
I think now's the time where everybody needs to become more creative, and think of different income streams. So, what can you do out there? People need to become creative. So for me, I have someone that does my social media, my business account, and I'm still doing that. He's still posting and stuff, but I'm also learning a lot myself. So I'm trying to, I have a personal account that I'm trying to build, and that one's more of fitness. So I'm kind of really trying to just engage with people everywhere. And like I said, just trying to be honest and being able to have different topics every day and just educating. Everybody's feeling the same. I think we all need positive energy. We don't need negativity. I think in the beginning, a lot of people were angry, and there was so much political stuff going on social media that it was almost like I had to take a break from watching news and social media, because instead of positivity, there was a lot of hate.
And that makes it hard to hear what's important too. Like, we need to know the facts. We need to know how to stay safe and keep our families safe and be realistic and plan ahead. But we don't need to be consumed with a lot of negativity that's unnecessary. I agree. Okay, so what would you know, a lot of people are reaching out to me, and I'm not the best person to ask. They're asking me, you know, what should I know about COVID-19? You're a nurse, tell me what to do. And I'm like directing them to the health websites, which have far more extensive information than I do. But as a nurse and as someone who's got kind of a finger on the pulse right now of what's going on in our area, what do you recommend to people that are living in our area as a nurse? What do you think? What would you want people to know at the moment?
At the moment, I want people to continue to stay positive and know that, like I said, this will eventually be over. Being panicked is not going to help the situation. So we need to take a breath and just calm down and be able to educate and stay united as nurses together. I do believe we need to continue to fight for our rights. And if something doesn't feel right, to contact your union. If you're at the workplace, I have a friend that's pregnant, like I said, and she doesn't know what to do because she's being in, like, you know, she feels unsafe. And I told her to contact the union. So whenever you're feeling uncomfortable and and you're being put in a position where you don't feel safe, the first thing that I would say is contact your union rep right away. Because you shouldn't have to feel that you're unprotected in any other situation. If I was at the hospital and I was given an assignment that I felt was unsafe or anything, what would every nurse do? A nurse would write usually a workload, like overload workload sheet, or you write an incident report, right?
Yeah.
If anything happens or you're, you know, scared about anything, incident reports get tracked. So if you're in the hospital, honestly, it's a very simple thing to do. And you just need to take it day by day. Unfortunately, this is, you know, we went to school to become nurses, to help people, to help care for people. And we need to remember that that's our duty. So as hard as it is in situations, you really need to put your feelings aside. And I know it's scary, but just be safe, and you got to do what you got to do, because that's just what you've been put on this earth to do. It's our calling, right?
Calling, yeah, it's not a career. I think when emotions run high, it's easy to forget that you have a support system and that there are, you know, other people who can stand with you, your union, and that kind of thing. The nursing organizations that we belong to serve a purpose, but if you're upset, it's easy to feel like you're alone and not reach out, right? So reaching out for help and going through the proper channels to document and take care of it is better than freaking out all alone, right?
I think right now a lot of nurses are coming together on social media. On Facebook, I've seen tons of posts being posted, tons of articles of us trying to make everybody aware of the situation. So, you know, what's going on with the, you know, with the equipment and everything like that, how nurses are feeling. There's tons of stuff being posted. I feel like nurses are being less silent, and they're coming up and they're speaking up really, really loud. And they know that social media is an amazing platform for that. So I think a lot of education has been done through social media these days. And so all we can do is continue to do that, to educate people.
Okay. It's been great talking to you. Thank you.
You too. Thank you so much. I highly suggest we do a call like this if you want. Maybe next week, and see how things are going, or in the next 2 weeks, and hopefully how things will change.
Great idea. Let's touch base and see if hopefully things are changing for the better, but I'd love to talk to you so that I know what's actually going on in our hospitals. Yeah.
Absolutely. Have a good day, hon.
Thank you. Bye.
Bye.